All right. Well, Happy New Year, everyone. It is a perfect time to cleanse if anyone is thinking about doing a cleanse. So, there's definitely many different options on cleansing, and we'll talk about two of the most common options. And then, if you guys have any questions about making your own cleanse, some pointers for that, then let me know, and I can always answer it at the end. So, we'll jump right in. I wanted to go over toxic exposures briefly. I don't want to scare anyone with talking about the toxins that we're exposed to all the time. Unfortunately, these are a lot of things that we can't avoid. There are things that we can avoid. Definitely the things that we're eating and putting on our skin, we can avoid to our best ability, but there's going to be pollution. There's going to be some chemical toxins that we're exposed to in our food, and again, in products, or again, just breathing and living our life. So this picture goes over some different areas to think about when we're thinking about the toxins that we're exposed to. So inhalation, the air we breathe, is going to contain pollutants both inside and outside. There have actually been a lot of studies looking at indoor air pollution versus outdoor air pollution. And there are certain studies showing that indoor air pollution occasionally is more concerning than outdoor for certain environments, depending on the furniture that you use, if you have lots of pets in the home, different things that could be bringing in some toxins from outside. And so when it is those nicer months of the year and there's good breeze, I usually have my patients, keep their windows open for a few hours a day just to get that airflow. It's not necessarily that there's more toxins inside, but we want to have that good airflow and that good movement. Skin absorption is another one. So the personal products that we're using, both on our body and then the products that we clean with that we can be exposed to through touching those products and through cleaning with those products. And so making sure that you're using products that are fragrance free or ideally have low fragrances in them, and then also that are not full of a lot of extra things that we don't need. So a good app to use if you want to look at your skin products is the website Skin Deep by the Environmental Working Group. You can type in your products. You can also scan your products and see what their rating is. And that's always a recommendation that I'll give patients if they're wanting to clean up some of their personal care products. Digestion is another one. So chemicals that are used in processed foods, again, pesticides if we're eating non-organic foods, and then certain foods themselves, depending on how processed those foods are. Some self-administered toxins are going to be smoking, alcohol, drug use, certain pharmaceuticals, over-the-counter medications, different things, especially ones that have dyes in them. So typically I'll have people try to avoid things that have dyes if you're using over-the-counter products. And then chemical toxins, I talked a little bit about these already. So again, pollutants, allergens, heavy metals in the environment, gases, pesticides, cleaning agents again, and then also chemicals that you might be exposed to depending on your line of work. So that could be hairdressers, that could be people that work at a nail salon. What chemicals are you exposed to on a day-to-day basis? We have our stress hormones that are a little bit more inflammatory to the body, like cortisol and adrenaline. If you're a patient of mine, you've probably had your cortisol tested in the morning. And so that's something I always like to look at and see if those levels are high. We also like to look at inflammation in the blood and see if those levels are also high as well. Internally produced toxins are another area. So certain, bacterial imbalances, yeast overgrowth in the gut, those are going to be producing some toxins. And a lot of those bacteria are going to create biofilms around them, which make them harder to kill. So they also release some toxins themselves. And then microorganisms, pretty similar to what I just mentioned: molds, bacteria, parasites, different viruses. I know there's been some really gnarly viruses going around the last month or so. So hopefully all of you that are watching this are feeling well. And then this is a example that I think is a little bit easier to comprehend than just thinking about all the toxins and how we're exposed to them. So this is the toxic bucket theory of health and disease. And so in this theory, we're looking at our health almost as a bucket, or our body as a bucket, and how many things can we be exposed to until our body is overwhelmed with these toxins and unable to process them. And so I usually like to describe, again, the body as almost a bucket. We have a drain. we can be exposed to, few toxins, and we're able to process those well. We're able to move those through our body. But as that toxic bucket gets more full, then we're going to have a harder time removing those toxins from our body. Our liver is going to feel overworked because the liver has to process everything that we're exposed to, from what we breathe in to what we eat to what we put on our skin. And so over time, the body can feel burdened by those toxins, and those toxins can store in our fat cells most of the time. Typically, they're more of the fat soluble toxins that stay around because they're going to, again, hang out in those fat cells and be released when we're doing something like cleansing. Or again, I don't want to highlight that you have to do a cleanse to eliminate toxins. Your liver is constantly working to eliminate toxins, but doing a cleanse is a nice way to help bring down that toxic burden, mostly through the foods that we're eating. So then our body is able to process those things a little bit better. Invisible exposures, I've really covered most of these already. So air pollutants, water, this is one we didn't talk too much about. One other website or resource that you can use is the Environmental Working Group's tap water database. And so if you are drinking tap water, it's really important to know what's in that water and what the levels of different heavy metals and different pollutants are. So you can look based on your zip code and see what's in your water. And then soil, again, when we're thinking about organic versus non-organic. Later in the presentation, I'm going to cover the Dirty Dozen and the Clean 15. So those are the fruits and vegetables that have higher level of pesticides. And so which ones should you prioritize getting organic versus which ones are likely more safe to get non-organic. Cosmetics, another one I talked about, and then plastics. This is also something that I do talk to a lot of my patients about, especially when we're talking about hormones, because a lot of plastics are endocrine disruptors, meaning that they can mimic and bind to certain receptors in our body, typically more the estrogen receptors. And so we want to keep our plastic usage at a minimum, ideally storing your food in glass and not in plastic, and definitely trying not to heat up foods in plastic as well. Heavy metals are another source. Again, we're exposed to these from multiple different areas. So what is a cleanse? Most of you probably know the general idea of a cleanse, but to highlight it, it's a change in your current habits to support elimination. So that's the broad definition. It can be very short, 3 days. Sometimes people will do a 3-day cleanse. There's 3-day water cleanses. Those can definitely be pretty hard to do. And then longer term cleanses, 30 days, 60 days. Some people want to do 90 days. There's also a popular 75 hard challenge that's going around right now. I have some patients telling me about that. And that's more of a whole lifestyle change for 75 days. The one that I'm going to highlight later is a 15-day cleanse. And then I'll also talk about Whole30, which is a very common 30-day cleanse and elimination diet that I will occasionally recommend for patients. So a cleanse is going to support your toxin elimination because, again, we're reducing some of the things that you likely are consuming on a more regular basis that might be burdening your body. And cleanses typically focus on liver support because, again, the liver is such an important organ to help detoxify our bodies and the things that we're exposed to. So these are some symptoms that might be helped by a cleanse. Again, the list is going to be much longer than this, but these are the ones that came to my mind the most and were the most common symptoms that I'm going to be thinking about a cleanse for patients. So acne or other skin concerns, that could be rosacea, that could be psoriasis. If there's an autoimmune nature to it, definitely a cleanse can typically help that. Allergies. A big one. I know here in Phoenix, a lot of people have allergies all year long, or again, they're worse in certain seasons, but there's still a little level of allergies depending on what you're allergic to and what's blooming at the moment. Gut concerns, I would say, is a big one. And so typically, bloating, constipation, gas, even diarrhea. Usually I'll work up those conditions a little bit more in depth prior to recommending a cleanse. I'll do some gut testing or some breath testing to see if there's something that's more clear. We'll usually focus on that first, and then, we'll go to a cleanse, or I'll have patients that have just a little bit of bloating, just a little bit of gas, and then we start with the cleanse and see how much better they feel on that cleanse. Fatigue is definitely a major one that a cleanse can help. When you're on a cleanse, how good you feel definitely depends on the things that you're currently doing that are maybe less beneficial to your health. So if you're smoking, drinking, eating a lot of processed foods, and then all of a sudden you cut those things out, you might feel pretty bad for a few days until, 4 or 5 days into the cleanse, when you start to get that burst of energy and all this natural energy. Headaches are another one. Insomnia can definitely be helped by cleansing, and then muscle pain and general inflammation. So not just muscle pain, joint pain, just feeling achy, feeling uncomfortable. Those are some of the most common symptoms. And then benefits of a cleanse, these go hand in hand with the symptoms of why we would suggest a cleanse. So increased energy, improved mood, clearer skin, more regulated digestion, and then overall improved metabolism. Sometimes I'll use a cleanse as almost a jump start for weight loss in my patients that are wanting to lose weight, because we can notice some benefits with metabolism within a cleanse. Definitely depends on how long you do. So 30 to 60 days, you're likely going to notice more of a benefit than doing a 3-day, a 6-day cleanse in terms of metabolism. So what does a cleanse entail? That's a great question, so I will answer it. The first one is removing interfering obstacles. So this is food, but also, again, it could be some lifestyle habits that we want to reduce during this time. And then adding in health-promoting foods and practices, and then supporting elimination pathways, because we want to move those toxins. We don't want to just eliminate things that might be adding to that toxic bucket, but we want to help that drain a little bit better. So removal, we're going to remove, ideally sugar is going to be one of the biggest ones that I focus on when I'm talking about a cleanse with people. Alcohol, artificial flavors, and then heavily processed foods. So heavily processed foods are not just foods that, again, might be high in sugar. They could just have gone through a very heavy processing cycle before they get to the table. And so typically during a cleanse, I like to always say, would you find it in nature, or are there a bunch of ingredients that you don't know how to read? So ideally during a cleanse, you're going to focus on eating more things that you could find growing, or, would be animal based. And so you don't typically want to be eating too many things that have, 5+ ingredients on there, or again, have things that you don't even know how to pronounce. So addition, kind of already went over these. Whole foods, vegetables, fruits, organic and grass-fed meat, those are going to be the basis of a cleanse. And then specific habits. So looking at your sleep hygiene. Is there anything that you could be doing better with your sleep hygiene? Could you be stopping looking at your phone, an hour or two before bed, versus if you're scrolling on your phone until you fall asleep? Are you having a tea to wind down, or are you having a drink to wind down at the end of the day? Are you, again, keeping the room nice and dark and cool, or are you being constantly woken up throughout the night because you need to urinate, or because the room is too hot and you're having to take off your covers? So looking at your overall sleep hygiene. For specific tips on this, you can ask your doctor here at Living Wellness. If you want to put any questions in the chat, feel free. Movement's another one. So when you're doing a cleanse, looking at your movement. Are you exercising a few times a week? Are you walking? Are you, again, moving that circulation? Because when we want to support these elimination pathways, we want our circulation to be a key focus. Are we sweating? Are we having regular bowel movements? Joyful hobbies is another one. So doing something that brings you joy and that keeps you, at ease and gives you a little bit of peace throughout the week. Stress management, this one's crucial. Stress is very inflammatory to the body. So do you feel like you have high stress levels? And is there anything that you could do to help mitigate those stress, or again, process that stress through engaging in some joyful hobbies? And then time in nature. This one's a favorite one for me. Getting outside, getting some vitamin D and that sunshine, especially now. It's a little chilly, but we can handle it. We can handle going on a walk, after lunch. Okay, anti-inflammatory foods. So I wanted to highlight these. These are just some examples of some pretty health supportive foods to think about adding more into your diet. So salmon, spinach, blueberries. Again, it's really just the whole and non-processed foods. Different beans and fruits and vegetables. Bone broth is another one. You can make your own bone broth, or you could get it from the store. That one you do want to look at the ingredients, because not all bone broths are created equally. So some are going to be more processed than others and have added things in them that we don't want. So a good brand that I typically tell people about is Kettle and Fire. I could drink that in a mug and not even just use it in cooking. And it's so supportive to gut and inflammation and skin health. And then here are the Dirty Dozen. So these are some different fruits and vegetables to keep in mind when you are shopping. These do change. I don't know if it's yearly, but it's definitely not the same as it was 5 years ago. So you'll see that this is the 2023 list of the Dirty Dozen. The 2024 should hopefully be coming out sometime this year. But these ones you want to focus on getting organic, because these do have higher levels of pesticides than some of the other fruits and vegetables. So strawberries, spinach, kale, peaches, pears, nectarines, apples, grapes, different peppers, cherries, blueberries, and green beans. So this is something that you can look online. I think that the Environmental Working Group has a little wallet PDF that you can download, so you can just carry it with you and reference that, so you don't have to memorize all these. And these you do want to focus on getting organic. And then the Clean 15. So these are the ones that have lower levels of pesticides. And so these you don't need to be as picky about getting these organic. So carrots, watermelons, sweet potatoes, mangoes, mushrooms. I won't read you all of these, but these are the Clean 15. So again, these have a little bit more wiggle room. Okay, so elimination pathways. So this is something when you're doing a cleanse that, again, is very important. We want to be supporting these elimination pathways, because if we're trying to reduce our toxins and you're constipated and not having a bowel movement, then a lot of those toxins are just able to get reabsorbed into the body. So we want to be making sure that you're having regular bowel movements. That will typically be a change that people notice within the first few days of a cleanse, is that if they were struggling with constipation or diarrhea, their bowel movements tend to become more normalized, or having them at more of a consistent time where they can expect to be having them. And then regular sweating, deep breathing. So this picture on the right, these are all of our emunctories. And so these are channels that we detoxify through. So these are things to keep in mind to make sure that all of these things are, again, working and things are moving through them. So our skin, so that's where sweating comes in. Our lungs, so the deep breathing, or just breathing well, breathing from deeper and not just that upper shallow breathing. Kidneys, I mean, these you might not know how well they're filtering, but good hydration is important here, because so many things are being processed through our kidneys as well. Our liver, so cleansing in general is going to be supportive to the liver to move these toxins through. The gut, so again, having regular bowel movements, and then our lymphatic system. And so there's lots of different tips for lymphatic drainage that I will go over in this presentation, but that's another area where we can support circulation. So a little bit more detailed science class on the liver. The liver has two distinct phases, and then we have a third phase that I always like to talk about. So phase one of the liver is typically the unlocking of the toxins. And so the toxins have to go through phase one. These are more of those fat-soluble toxins that these specific nutrients are needed. I don't know if you can see my cursor, but I am highlighting the nutrients needed at the bottom. And so our body needs these nutrients to process those toxins. Then those toxins move over into phase two, where then that's typically more of the neutralize is what I like to say phase two is. So phase one is more unlocking, phase two is neutralize, and then phase three is typically eliminate. And so phase two, there's all these conjugation pathways that are happening, and there's even more nutrients needed here to conjugate those different toxins. And then we have our elimination pathways, again, urine, bile, stool, sweat, breathing, all of those emunctories. So lymphatic support, so there's lots of different ways to support the lymphatic system. Hydrating, it's very important to get enough water in throughout the day. And so a typical rule of thumb is half your body weight in ounces. And so make sure that you calculate that and are getting at least that much water in a day. If you are urinating very frequently from drinking that much water, that's typically a sign that you need minerals in your water, especially if you're drinking reverse osmosis water or heavily filtered water. Then a lot of those different ways to filter are going to remove most of the minerals along with some of the pollutants that are being removed. And then sweating, so again, through the skin. Exercising, of course, is an amazing way to sweat. Doing warm baths, that's another nice way. You can add some Epsom salt into the bath and get some good magnesium there. And doing saunas, especially now, 6 months ago, we could just walk outside and sweat. Now we have to really work up a sweat if we're doing it outside, but you can hop in a sauna if your gym has one. There's sauna blankets that you can get. There's little tent saunas that you can have in your house. This is not just for the cleanse. This is supportive to your health in general. So it's something that could be worthwhile to invest in, especially if you feel much better after you sweat. And then alternating hot and cold in the shower. So there's ice plunges you can do. There's all these more extreme methods to support the circulation, but a really simple, easy, cheap thing to do is just turn your shower water on cold and then turn it back on warm and then turn it on cold. Or just end your shower with a little bit of cold. That's going to help wake you up. That cold is going to put you more into a parasympathetic state, which is that rest and digest state. So that's good for stress management as well. But that's a pretty easy way to get that circulation moving through your body. And then dry skin brushing. If you are going to dry skin brush, you want to brush up to the area of the heart. And so if you're starting with your arm, go up. Again, you want to all go to the area of the heart. Okay, so this is a really common cleanse. This is the one that we carry in the office because all of us doctors here really like this one. It's pretty easy to follow, and it's a good 2-week cleanse where, again, it's not 60 days, 90 days. It's a nice jumpstart cleanse to start with. So this is the NutriClear Plus. Within this cleanse, you get 30 packets of a powder and then 30 supplement packets. And so what you do is every day you have 2 shakes a day and 2 supplement packets a day. If you are doing this cleanse, most of the time you'll be able to stop all the other supplements that you're taking. But that is something that you should ask your doctor individually about, because I'm not saying that everyone should stop the supplements that they're taking, but that is a pretty common thing to do during a cleanse, is you stop your day-to-day supplements and you focus on these digestive supportive supplements and liver supportive supplements. And so within the packets, there's different supplements that have different actions. So we have this bromelain plus CLA. So that's more of a digestive enzyme, and it has bromelain, which again helps break down our foods. And so that packet or that specific pill is going to have enzymes that break down our protein, our carbohydrates, and our fat. And then these other 4 ones, the beta TPC, the Livotrit, the BioProtect, and the MCS2, those are all liver supportive. So you'll have those 5 capsules in each packet. And then you'll get a shaker cup. So if you're doing another shake, let's say at lunch and you're at work, you can just have your shaker cup there. You pour in the powder, you add some water, or you add some unsweetened alternative milk to that, and then you can have your lunch. And then you get a guidebook in here, which is pretty thorough. I have some examples of the guidebook as well, but that's something that comes in the cleanse kit. So a sample menu that also comes in the kit, so you can get some ideas. But basically, again, you might want to rotate. So you might not want to do breakfast as a shake every day. If that tends to, bore you, then you can eat breakfast that one day and then have the shake for lunch and dinner and just rotate them through. So this is just a sample. You have a shake and a supplement packet for breakfast. For snack, you have an egg and some blueberries. For lunch, you have another shake and a supplement packet. You can have another snack, and then you have dinner. So typically I'll recommend that you're doing 1 meal and then some snacks throughout the day as needed to, again, stay a little bit satiated. You should not be starving when you're doing this cleanse. You should still be able to feel pretty full. You don't need to be, again, feeling like you're starving for it to be done successfully. And if you need another meal, if you are exercising frequently and you just feel like you need some more protein, you need some more nutrients in it, you can do more than just that 1 meal. That's just the general recommendation. So there is some wiggle room, because of the foods that are allowed, you can really eat as much of that as you want. So then this is a good example of what the packet looks like, where it shows these yes and these no categories. So yes are the things that you can eat, again, as much as you'd like, and then the no's are the things to eliminate. There are some caveats here for some people, like ideally you don't have any coffee, but for a lot of people, if they've been drinking a lot of coffee and they completely go off of it, they're likely going to get a headache. And so this is where you can also work with your doctor and your provider about what things might be okay to do. So I'll typically just ask people to switch to just black coffee if they're doing coffee with creamer or oat milk or different things that are a little bit more carb rich or sugar rich. I'll have them ideally just go to something a little bit more plain, and that's not going to impact them as much. So those are, the yes and the no categories. Just going to look and see if there's anything I wanted to highlight on here. I think it's all pretty self-explanatory. So that comes in the supplement packet. And then this is also a common cleanse that has many different resources out there. There's books on it. There is countless number of recipes out there. So there's the Whole30. Essentially, you're eating whole foods and you're eliminating processed foods. You're eliminating sugar. Oh, one thing I did want to mention is that dairy tends to be eliminated on cleanses as well. Some people can process dairy okay, but a lot of dairy can be inflammatory to the body. And for some people, even a little bit of dairy can be inflammatory to their body. And so that is something that does tend to be removed during a cleanse. And then you bring some of those things back in and you can see if, oh, I felt amazing during these 2 weeks. And then I started bringing some of these things back in and now I don't feel good again. And you can better identify what foods might be more triggering to your symptoms. So Whole30 is another one. I have a few patients that are doing this right now. They tend to just do it every January to start their year off on a good note. And so that's also something that I'll talk to my patients about, because this one, again, you don't have to buy any supplements or any protein powders or shakes. This one is just food-based. So you still are able to have 3 meals a day, some snacks, and there is a lot of recipes that you can find for this one. So that's all. Perfect. Yay. I did not want to hold any of you past the 30 minutes because I know it's the weekend and hopefully all of you have some fun plans coming up. And if you have Monday off, then that's exciting. Hopefully you get to relax, rejuvenate, enjoy some time. And if anyone has any questions regarding the cleanse, either ask me or you can ask your provider here at Living Wellness. And yeah, I hope you all have a lovely rest of your day and weekend, and I will talk to you guys later. Bye.